Okay, today we will have seen clinical and pharmacological characteristics of the vitamin medicine. We discuss about the vitamin group A, B, C, D, E, K. What difference between the vitamin and non-vitamin medicine? And for example, for the human, for our patients, the vitamin C, ascorbinic acid, that is the vitamin, but the ascorbinic acid is not vitamin for the rats. Why? Because the organism absolutely need this remedies, medicine, this vitamin for the very many metabolism process reaction, but organism cannot synthesize these drugs. But rats can produce the ascorbinic acid. That's why the vitamin, that is the not vitamins for rats, but yes, for our patients, for the human body. Okay, some information is about the vitamin A, retinol. Functional part of the visual pigment, rhodopsin, that is the physiological function of this vitamin in the retina, regulations of the gene expressions and cells differentiations, P-carotene, provitamin A as an antioxidant. When the patient has the deficiency of this vitamin from food, from meal, vision impairment, hemeralopia, night blindness, xerophthalmia, keratizations of the skin. We like to use this vitamin as a replacement therapy, but very many problems, sometimes very high dose of the vitamin A provocate for our patients if this patient has the chronic problems of the liver. These prescriptions, very high dose, very like to prescribe the dermatologist for the treatments of the skin. But we must remember, the high dose and long time using of the retinol acetate, the vitamin A, provocate of the transforming of cells ETO to the fibroblast in liver. And this fibroblast start to produce the very high concentrations of the glycosamine glycan and provocate of the progression of the fibrosis in the liver. That's why if that is the short time, not very high dose, please, if that is patient has the chronic hepatitis, cirrhosis, or another disorders in the liver, we must to prescribe this vitamin A very, very accuracy. Vitamin B1, thiamine. Functional part of the coenzyme TBP in the pyruvate and alpha-ketoglutarate dehydrogenase transketolase fully define the functions in the nerve conduction. If the patient has the deficiency of the B1, vitamin thiamine, the patient has problems with name beriberi, polyneuritis beriberi, peripheral nerve damage, or central nervous system's lessons, Wernicke-Korsakoff syndrome. Concentrations of the pyruvate is increased in the patient's blood, the most of which of the excreted with the urine. For example, the most important and more aggressive, very dangerous symptoms when the patient has the deficiency of this vitamin, that is the aphasia, emasculations, paresthesia, disorders of the peripheral nervous systems, dyspnoea, orthopnoea, great weakness, and others, and emergency help. Introductions of these vitamins save the life of our patients. For the prophylaxis, for example, and sometimes for the treatments, we can use the capsules of the thiamine, 100 milligram, vitamin B1. Next, vitamin B2, riboflavin function, and functional part of the coenzymes 5D, flavononucleosidase, in oxidation reduction reactions. If the patient has the deficiency of this vitamin, the patient has the epithelial mucosa, cutaneous, corneal lesions in come of mouth, lips, and tongue, seborrheic dermatitis. For the recovery of the concentrations of the vitamin B2, we use the riboflavin, 100 milligram per capsules. Vitamin 3, vitamin PP, niacin, nicotinic acid, nicotinamide, functions and manifestations of this deficiency of this vitamin. Functional part of the coenzymes and NAD and NADF in oxidations, reductions, reactions. If the patient has the deficiency of this vitamin, pellagra, the patient has the photosensitivity, dermatitis, glossitis, tongue inflammations, alopecia, hair loss, edema, swelling, diarrhea, depressive psychosis sometimes, aggressions, ataxia, lack of the coordinations, dementia, weakness. Sometimes these patients come in to office of the neurologist, psychiatrist with this, or dermatologist with these problems. A classic variant of the dermatological disorders, when the patient has a deficiency of the vitamin B6. Organism cannot produce these drugs, and only with the food these patients can use these absolutely necessary remedies. Nicotinic acid, 250 milligrams, we like to prescribe for the patients with the diabetes mellitus. Why? Because provide the increase in the circulation of the peripheral tissues, but most important, it is a recover, that is the practically specific treatments, replacement treatments for our patients with the deficiency of the vitamin B6. Vitamin B5, pantothenic acid, functional part of the coenzyme A, universal acyl carrier in the Krebs cycle, when the organism utilizes the glucose, and from 1 molecule of the glucose cycle, Krebs produce 38 molecules of the ATP, 30 and other carboxylic acid metabolism, and phosphopanthenin acetyl carrier proteins in fatty acid synthesis. Numbness in the toes, when the patient has a deficiency of this vitamin B5, pantothenic acid, or toes burning sensations in the feet, the defect of the mucous membranes of the internal organs, early graying, hair loss, various disorders of the skin, the development of small cracks in the corners of the mouth, the appearance of the white patches on various parts of the body. There may also be depressed mood, fatigue. Classic clinical symptoms, angular cheilitis, when the patient has a deficiency of this vitamin. Replacement therapy, 250 milligrams per 1 capsules of the pantothenate, vitamin B5. Next, vitamin B6, pyridoxine, functional manifestations and what roles in the metabolism of the organism this vitamin has a functional part of the coenzyme core A, universal acetyl carrier in Krebs, functional part in coenzyme PLP, and transaminations or decarboxylations of amino acid and glycogen phosphorylase. Dermatitis, if the patient has the deficiency of the B6, the patient has the problems with the eyes, nose, mouth, there is mental confusions, glossitis, peripheral neuropathy, convulsion. Sometimes the symptoms of the dermatitis are this picture of the deficiency of this vitamin. For the replacement therapy, we use the vitamin B6, 100 milligrams in 1 capsule. Vitamin B7, biotin, coenzymes of the carboxylation reactions in the gluconeogenesis in liver and fatty acid synthesis. Simply, what if the patient has the clinical symptoms, when they think maybe that is the deficiency of this vitamin, when the patient has the seborrheic dermatitis, anemia, depressions, hair loss, high blood sugar level, inflammations or pallor of the skin and mucous membranes, insomnia, loss of the appetite, muscles itches, nausea, sore tongue, dry skin, high blood cholesterol. Classic clinical symptoms, dermatitis, sometimes problems of the hair loss, problems with the nails, special line. Yes, on the nails we see there, we think maybe there is the deficiency of the vitamin group B. Biotin, we can use these drugs in tablets for the replacement therapy. Vitamin B9, folioacidic, functions and manifestations of hypo and avitaminosis. Functional part of the coenzyme THFA in transfer of the 1 carbon fragment. Megaloblastic, if the patient has the deficiency of the B9 and B12, that is the problems of the hemopoietic part. And patients will have the megaloblastic, megakaryocytic, hyperchromic anemia. That is the only one anemia when the concentrations, the volume of the hemoglobin in one erythrocytes increase. If you will see to the color index, we can find these informations in the classic clinical analysis of the blood. We will find more one of color index of the erythrocytes, sometimes 1.2, 1.2, 1.3, and more. And we see deficiency of the erythrocytes. We see the decreasing of the hemoglobin, but very high level concentrations of the hemoglobin in the one erythrocytes. The clinical symptoms, when we think maybe that is the B12 folioacidic anemia, when the patient has the red tongue, sometimes patients talk us, doctor, I have the very intensive pain on the tongue, maybe after the using of very hot tea. Anemia, lethargia, fatigue, insomnia, anxiety, digestive disorders, growth retardations, breathing difficulties, memory problems. Deficiency during pregnancy is associated with the neural tube defect in fetus. That's why we recommend, please use practically all time, all pregnancy, folioacidic, but very important, the dose of the folioacidic. Practically, in real clinical practice, we don't recommend the very low dose of the folioacidic. For example, half of the gram, 500 milligram of 1 gram. No, that is the maybe as psychological help, not more. Really effective therapeutic dose, that is the 5 milligram per day. Folioacidic, that is the save the health of the pregnant woman and the fetus, future child. Sometimes vitamin B9 we use in the real clinical practice in tablets, but very important, that is the combinations of the B9 with the B12 vitamin for the treatments of the B12 folioacidic megakaryocytic anemia. Cyanocobalamin, vitamin B12. Functional part of the coenzymes adenylyl cobalamin and methylcobalamin in transfer of the one carbon fragment and the metabolism of the folic acid. Vitamin B12 deficiency anemia. Why that is very important? In my real clinical practice, I saw very many patients without the correct diagnosis of these patients. Sometimes these patients come into the neurologist, very intensive radiculitis, peripheral neuropathy, and patients don't understand what. The doctors prescribe the non-steroidal anti-inflammatory drugs, analgesic therapy without any effect. But if the patient's very accuracy will study the clinical analysis of the blood, the doctors can find these hematological disorders, anemia, low level of the hemoglobin, low level of the erythrocytes, but one erythrocytes will contain very big concentration of the hemoglobin. That is the vitamin B6 deficiency anemia. That is the perniciosis anemia. Addison-Bemer anemia is one of many types of the megaloblastic anemia with the generations of the spinal cord, anemia, fatigue, depression, low-grade fever, diarrhea, weight loss, neuropathic pain, glossitis, small and red and smooth appearance of the tongue, angular cheilitis, soreness of the corner of the mouth. Possible manifestations are also hypochromic anemia, splitting hair and loss of the hair, increased nail, bottling, and the test alteration. One clinical symptoms, early clinical symptoms, hyperpigmentations on the little joints, for example, on the hand. Hyperpigmentations, first clinical, very interesting, important clinical symptoms for the verifications of the B12 folioacidic. Insufficiency of these two vitamins. Usually the patients, they just the patients with the problems of the malabsorptions, maldigestions, the problems after the operations of the intestinal tract. Sometimes it is the bacterial growth in the colon, for example. These situations, stopping of the synthesis bacteria of this vitamin, and patients has the problems of the absorptions, these two vitamin, folioacidic and cyanocobalamin B12. So cyanocobalamin injections sometimes we use, but the patients don't like these injections. Why? Very, very intensive pain during the intramuscular injections of this. But sometimes in the emergency situations, we can to prescribe this form of the cyanocobalamin. Vitamin C, ascorbinic acid. It serves as the donor of the protons of the hydroxylation reactions for the collagen synthesis, catecholamines and steroid hormone synthesis. And we must remember, you will have the questions in the CROC too. For example, what methods for the preventions of the insufficiency of the suprarenal gland when the patient use long time steroid therapy? For example, tablet therapy of the prednisone, 30 milligram per day. One tablet of the prednisone, 5 milligram, 2 tablets 3 times per day, 30 milligram per day. But per some period, one of the side effects after the using of these drugs, that is the depressions of the synthesis of cortisol in the suprarenal gland of these patients. For the preventions of this insufficiency, we like to prescribe the ascorbinic acid. Ascorbinic acid, that is the stimulator of the functions of the suprarenal gland and synthesis of the cortisol in these organs. It has properties of the antioxidant, enhances absorptions of iron, and we must remember all practically drugs, maybe 90% of all drugs of iron contain the vitamin C. That is a classic symbol of the pharmacokinetic synergism. The vitamin C help to the iron to move from the intestinal tract to the blood. Sometimes, if the patient has the iron deficiency anemia, we recommend use the vitamin C together with the meal for the increasing of this process of absorptions together with many food which contain the iron. But another situations, what we use informations for the treatments of the patients with the hemochromatosis, syndrome of the overload of the iron, when the patient has the very many iron in the liver, in the pancreas, in other organs, we must stop of the introductions of the new dose of the iron. What methods? We don't recommend they don't use any food or, for example, the fruit which contain the high dose of the vitamin C, ascorbinic acid. We stop it. That is, we stopping of the process of the iron introductions from the gastrointestinal tract to the blood. Another using of informations about this fact. Okay, scurvy, general weakness, subcutaneous hemorrhages, if the patient has the deficiency of the vitamin C, frequent hemorrhages from internal and mucous membranes, gingival hemorrhages, loss of the teeth, formations of spots on the skin, spongy gums, yellow skin, fever, neuropathy. Multiple hemorrhages in the places of the clothes frictions and are possible if a person often experiences acute respiratory infection. Classic clinical symptoms of the deficiency of vitamin C. Sometimes these patients with the gums, with the lips, with the mucous irritations coming to office of the doctors. What methods? The prescriptions of the high dose of the ascorbinic acid for the recovery of the concentrations, but I'm consulting of the difficult patients with the difficult diagnosis in the medical center in Kiev. And sometimes I saw the young women with the symptoms of the oxalaturia, high concentrations of the oxalate in urine. My first questions in this situation, did you use the ascorbinic acid in very big concentrations? Yes, doctors, yes, I like for the health, for the safe, my external picture, for maybe inducing my energy and other. But you must remember the very high dose, a long time using of the ascorbinic acid provocate of the removing of ascorbinic acid per urine with the urine clearance. And these factors, high level concentrations of the ascorbinic acid, induce the chance of the increasing of concentrations of the oxalate, and sometimes provocate of the inductions of the stone genesis in the kidneys. That's why what matters for the recommendations, please immediately stop of using of your ascorbinic acid, because that is the symptoms, oxalaturia, of the overdose and over concentrations of this vitamin in urine. Vitamin D, calciferol. What functions, physiological functions of this vitamin? Stimulations of the calcium absorption through intestinal wall, maintenance of the calcium balance and mobilizations of bone mineral, rickets, if the patient has a deficiency, poor mineralizations of bone, osteomalacia, bone demineralizations, osteochondrostasia of the lower extremities, and the delayed mineralizations of the cranial bones and 1/3 or in infants. But very important, the low-level concentrations of the vitamin D provocate very many polyorganic, polytopic problems. For example, the problems of the immunity. When the patient has the very often episodes of the viral of bacterial infections, we must remember, maybe that is the deficiency of the iron, for example. That is the real problems for many patients. That's why we must check all the concentrations of the ferritin. Ferritin provide the for us informations how many iron contain the tissues of our patients. If the patient has a very low, we must to prescribe, for example, iron plus vitamin C for the recovery of the concentrations. That is the very serious and very often source of repeating of the bacterial infections and immunodeficiency, secondary immunodeficiency of our patients. And second problems, that is the deficiency of the vitamin D. That is the real problems. And my recommendations, please check off level of your D, vitamin D, and if you have the deficiency, please recover with the pharmacotherapeutic help of this very important part of the metabolism of the organism. If the patient has the deficiency of the vitamin D, sometimes it is a liver failure, renal failure, nephrotic syndrome, cystic fibrosis, celiac disease, that is the cofactors which provide these problems. Sometimes that is provocate the diabetes mellitus type 2, muscle pain, rickets, osteomalacia, osteoporosis, autoimmune disease, allergic disease. That's why that is the very, very important part and to recover this vitamin D. Sometimes that is the results of the vegan. Some people don't like to use the meal and fat. Use only carbohydrate, only and don't like to eat the fat meal. But if the patient has not absolutely deficiency of the fat in the meal, these situations provocate absolutely non-absorptions of the lipid-soluble 4 vitamin A, D, E, K. A, that is the problems with the vision. D, that is the problems with the immunity, osteomalacia, bones, and others. E, that is the problems of antioxidant protections, for example, the skin. EK, that is the problems of the coagulations, hypocoagulations, and hemorrhagic syndromes in our patients. That's why the absolutely normal food, normal regime of the food provide the adequate working of our immunity and other organs. For the recovery of the vitamin D, we can use, for example, 5,000 units, practically that is the therapeutic dose, but not more. Sometimes the patients like to use very, very high dose, for example, 20,000 units every day. What results? Increasing of the concentrations of the calcium, and calcium want to remove from the organism per kidneys and per bile. And we see in the ultrasound diagnostic of these patients what? Stones in the gallbladder and stones in the kidneys. And for the first, we ask, did you have the very high dose and long time, the vitamin D without the control of the concentrations in the blood? Yes, I can. We must understand only adequate dose provide the health of our patient. Vitamin K, phylloquinone. Functions, coenzymes in formations of the gamma carboxyl glutamate residues in structure of factor 2 prothrombin, 7, 9, 10, 14 proteins C, blood coagulation systems, bone matrix proteins, impaired their blood clotting, that is the clinical symptoms of the deficiency of the vitamin K, hemorrhagic disease, osteoporosis, and coronary heart disease. Intestinal dysbacteriosis occurs hemorrhagic syndrome. For example, if the patient has the vitamin K, that is the problems of the cardiovascular system, sarcopenia, the COPD, chronic obstructive disease of lungs, sarcopenia, that is the decreasing of the concentrations of the fat in muscles, chronic kidney disease, and osteoporosis. For the recurrent, we can use the vitamin K, 100 microgram for the help in this clinical situation. Very interesting vitamin E. Now we discuss about the very interesting, very popular. Every day I prescribe this vitamin in real clinical practice. But for our patients, their everyday concentrations must be no more than 800 milligram. 400 milligram 2 times per day. That is the normal and maximum adequate dose for the prescriptions of the vitamin E. If you will prescribe, or sometimes the patients use without our recommendations, use very high dose, 2-3 times more. We must remember vitamin E, that is the antioxidant, that is the practically very effective, very aggressive antioxidant for stopping of the free radicals. But if that is the high very dose of the vitamin E transforms from the antioxidant to the pro-oxidant. That's why we must repeat, don't use not more, please, for the stopping of the aggressive free radicals. But vitamin E is a family of the lipid-soluble compounds consisting of the 2 major groups, namely tocopherols and tocotrienols. Each group can be further divided into the 4 different isomers, that is the alpha, beta, gamma, and delta, depending on the presence and positions of the methyl groups as the side chain. Generally, vitamin E is made up of the chromanol ring and as the isoprenoid of phenyl side chain. Tocopherols have a long and saturate side chain, while the tocotrienols differ from the tocopherols by the presence of the unsaturated double bond on the side chain. This also explains the high affinity to tocotrienols to the lipid membranes compared to the tocopherols. If the patient has a deficiency of the vitamin E, that is the problems in the brain, that is the encephalomalacia in the cerebellum, that is the erythrocyte hemolysis, for example, erythrocytes, gizzard myopathy, gizzard muscles, exudative diathesis usually that is in children period, capillary walls, that is the steroid accumulations, the adipose tissues, and muscular dystrophy, striate the muscles. Vitamin E, particularly tocopherol, can easily be obtained and consumed by the vast majority of the world's populations. It is ubiquity found in various staple foods, such as vegetable oil, palm oil, rice bran, wheat germs, olive, barley, soybean, nuts, and grains. Meanwhile, the tocotrienols are also found in many different natural sources. Similar to tocopherols, the percentages of the gamma tocotrienols contain are different from the one source to another: rice, bran, palm oil, and annatto. Both tocopherols and tocotrienols as well known for their potent antioxidant properties. They are capable of the scaling reactions oxygen species and free radicals. The presence of hydroxyl group on the chromanol ring contributes to the antioxidant activity by readily donations the hydrogen atom to reduce free radicals. In addition, vitamin E also possesses anti-inflammatory effect apart from the antioxidant properties. These properties of vitamin E have attract great interest among researchers to investigate its therapeutic potentials for the preventions and the treatments of the various diseases. Pharmacodynamics of the vitamin E has gained researchers' attention as a potential adjuvant therapy for the various disorders due to the excellent antioxidant and anti-inflammatory properties. Inflammation is a result of the enhanced body immune response and is characterized by the increased productions of free radicals and pro-inflammatory mediators, which may lead to excessive damage to host tissues. Its occurrence indicated by the presence of the markers such as cytokine and C-reactive protein. Furthermore, the secretions of the substance such as eicosanoid and pro-inflammatory cytokine enzymation, and then not only results in inflammations but may subsequently trigger tumor growth and invasiveness, leading to cancer. With regard to the anti-inflammatory properties of the vitamin E, several studies have demonstrated that vitamin E could inhibit the secretions of the inflammatory mediations molecules such as eicosanoids and cyclooxygenase 2 enzymes, COX-2. Vitamin also suppress the pro-inflammatory signaling pathway such as nuclear factors kappa beta and FKB, and signal transducer and activators of the transcription 3, STAT3 mediated pathways. The antioxidant and anti-inflammatory properties of vitamin E are highly beneficial for the future therapeutic use. A number of studies have been performed to demonstrate the benefits of the vitamin E in various aspects in health, including neuroprotections, cardiovascular, skin, and bone health, as well as for treating cancer. Different routes of the administrations for vitamin E may be applied to the different therapeutic uses, but sometimes the patients know about the very excellent anti-inflammatory, anti-cancer, and other results. Use this vitamin in very high dose, very long time. What results? Sometimes the results of this using, that is the cancer. Why? We must remember the lymphocytes of our patients use the enemy to the cancer, to the viral, to the bacteria, that is the free radicals attack. That is the enemy of these lymphocytes. And what idea of using of the vitamin E? We must stopping of the over-aggression answer of these lymphocytes with the destroying of tissues of our patients, destroying of the vessels and others. That is the practically methods of the protections. But if the doctors of personally patients use very high dose, practically this antioxidant effect of these lymphocytes, stopping of the anti-cancer effect of lymphocytes of our patients. That's why we usually recommend you can use of the vitamin E 400 milligrams 2 times per day during the 3 weeks, not more. After this period, we must stop of the using for the recovery of the immunity systems of our patients, 1-2 weeks. And only after this, we recommend the using of the vitamin E for the prophylaxis of very aggressive stopping of the activity of the natural killer CD4 and another lymphocytes, and for the preventions of the tragic results of our iatrogenic treatment. Okay, what effects of the using of the vitamin E? We must remember the drugs, that is the enemy. And we must to prescribe according to recommendations. And sometimes we must understand why the concentrations of our prescriptions drugs very high, of very low, ineffective, of very dangerous. Very many factors can change the concentrations, but pharmacotherapeutic index, pharmacotherapeutic distance, very important for understanding. And side effects sometimes more dangerous after the using of the drugs than the main disease, which we want to treat. Okay, pharmacological properties of the vitamin E: antioxidant, anti-inflammatory, skin protections, neuroprotections, anti-atherogenic, anti-diabetic, anti-obesity, bone and joints protections, anti-cancer. But we must understand all time the concentrations of this vitamin E in the therapeutic index, and please don't use very long time without the episode of stopping of using of this vitamin. Routes of the vitamin E administrations, that is the oral form. We can use when the patient has the Parkinson's disease, Alzheimer's disease, obesity, diabetes, atherosclerosis, pancreatic and the skin cancers, radioprotections, osteoporosis, rheumatoid arthritis, osteoarthritis. Or parenteral, sometimes we can use when the patient has the breast cancer, traumatic brain injury, photoprotections, no intravenous injections when the patient has the breast cancer for the stopping of the side effects of the chemotherapy usually. Okay, vitamin E possesses a neuroprotective effect, and this has been proven in clinical trials and models of various neurological disorders, including the traumatic brain injury, Alzheimer's disease, and Parkinson's disease. A randomized double-blind controlled trial involving adults with severe head injury reported that intramuscular injections of vitamin E had a significantly lower mortality rate compared to the vitamin C and placebo-treated groups. An in vivo study involving albino rates, for example, subject to the TBI, showed low malondialdehyde levels and mortality rates when administered alpha-tocopherol alone or in the combinations with the vitamin C, compared to the non-TBI group. Vitamin E, especially tocotrienols, has also been studied thoroughly for its potentials and preventions, metabolic syndromes, and cardiovascular disease. Well, that is the side effects of the diabetes mellitus type 2. These effects are mediated through its antioxidant mechanism, anti-inflammatory effect, inhibitions of the reductase enzymes, and reduced expressions of the adhesion molecules. In addition, vitamin E is also widely used in the field of the dermatological for the antioxidant and ultraviolet radiations protective effect, which provide photoprotections and delay skin aging. A study performed on human gluteal skin showed that the prior treatments with the newly formatted vitamin E topical agent results in improved photoprotections against minimal ultraviolet radiation. Vitamin E also inhibits anti-aging effect through its ability to exchange collagen synthesis and prevent collagen degradations. This is due to the increased expressions of endosome docking fusion proteins, which contributes to the degradations of the melanosomes by docking to lysosome. With regards to its potential applications for cancer treatments, vitamin E possesses promising anti-cancer properties such as suppressions, cancer cells proliferations, preventions angiogenesis, modulations growth factors, promotion cells arrest, and including apoptosis. These special properties tocotrienols have been reported in various in vitro studies using different cells, illness, breast, lungs, liver, pancreas, skin, and bladder cancer. Several in vivo studies have also shown that the tocotrienols successfully accumulate in cancer cells, but not in normal tissues. Previous study demonstrate the 5 tocotrienols significantly exchange the efficiency of the gemcitabine to inhibit pancreatic cancer growth and the survival in vitro and in vivo by suppressions NFKB activity. Another study of mouse melanoma showed that the 5 tocotrienol treatments significantly reduced the tumor volume and delayed tumor progression. Similar to other lipid-soluble vitamin E absorption is highly dependent on dietary fat in food, in body, bile salt, and pancreatic enzymes. During oral administrations, vitamin E is packed into chylomicronics, a large triglycerides-rich lipoprotein produced from lipids, mainly fat acid and cholesterol, in the intestines and enter the circulations via lymph nodes. Once vitamin E is packed into chylomicrons, it can be sent either to tissues of the liver. The hydrolysis of the chylomicrons by lipoprotein lipase enzymes in the circulations allows the transfer of lipids and vitamin E to tissues. The chylomicron remnants will also be taken up by the liver. Most of the vitamin E in chylomicron remnants will be incorporated with the very low density lipoprotein, while the rest will be excreted in bile. Vitamin E is then metabolized through the hydroxylations and oxidations of its side chains by cytochrome P450. The final metabolism, which are the carboxyethyl hydroxychromans and carboxymethyl butyl hydroxyromans, will then be excreted by urine and feces. Compared to the other lipid-soluble vitamin shown to be evenly distributed in body, especially in the plasma, liver, and adipose tissues. In another study, for example, tocotrienol were found to be preferably absorbed by adipose tissues in rats. However, this uptake was attending the presence of the tocopherol. Very interesting newest form of the vitamin E. Maybe this form provides a more effective, really effective, to the organs of our patients. A lipid-based nanoparticular system, neosomes and liposomes. Neosomes and liposomes are rapid-based nanovessels that are highly promising for the delivery of the lipophilic drugs and active compounds. Neosomes are lamellar structures made up of non-ionic surfactants and cholesterol. On the other hand, liposomes are structures that consist of an aqueous core that is surrounded by one or more phospholipids, bilayer. Although they have almost similar physical and chemical properties by comparison, nonetheless, neosomes are shown to have a higher permeability to small solutes and ions than liposomes. Similar to liposomes are application of neosomes as a drug delivery vehicle is also suitable because they are not toxic, less expensive, and more stable. For example, that is the liposome structure. And practically, we can use this form for many vitamins. For example, for the vitamin E. Dissolution in fat and oil, absorbed with the dietary fat and transported in the blood by specialized carrier proteins, stored in the body fatty tissues and liver, remain in the body for a long period of time. Dissolutions in water, absorbed directly into the bloodstream, that is the water-soluble vitamins rules. They're non-stored to some extent as fat-soluble. Excess amount are excreted in urine, eliminated from the body more quickly. It is widely known that tocotrienol exhibit anti-cancer properties in vitro against many types of cancer, including the liver, lungs, pancreatic, and cancer. This form of the vitamin has the really effect to these situations. Nonetheless, the tumor-suppressed effect of the tocotrienols are not always observed in vivo, which could be explained by the poor bioavailability. To date, a limited number of studies have started to explore the potential use of the nanovesicles in enhancing the anti-cancer properties of tocotrienols. However, including its bioavailability and safety has yet not been explored. Solid lipid nanoparticulates and nanostructure lipid carriers are alternative for liposome, as they use different lipid components that offer better drug loading efficiency and they're suitable for the large-scale manufacturing process. The solid lipid nanoparticulates are made up of a lipid monolayers enclosing of the hydrophobic solid lipid core that permits incorporations of the lipid-soluble compounds, while the non-structural lipid carriers are known as the second generations of the solid lipid nanoparticulates. NLC differ from the SLN in the compositions of the lipid core, which is made up of the amorphous solid and liquid oil matrix. Scheme of this structure: targeting antibody, drug targeting peptide. The presence of this unique lipophilic core in both solid lipid nanoparticulates and nanostructure lipid carriers make them the ideal carriers for the various lipid-soluble compounds, is a reduced substance mobility therapy alone controlled by release. Both vitamin E encapsulated SLN and NLC were prepared using the solvent evaporations methods, which usually involves high shear the homogenizations of hot high pressure homogenizations technique, followed by ultrasonications to obtain a stable nanopractice formulations. A previous study found that the NLC are superior to the SLN in terms of the stability and the loading capacity. There was also evidence showing that the NLC also enhances the anti-cancer properties of tocotrienol. Moreover, vitamin E-loaded SLN and NLC were also reported as safe since both formulations did not trigger skin irritations upon topical applications. Taken together, these studies suggest the use of the SLN and NLC formulations is beneficial in improving the bioavailability and efficiency of the tocotrienols. Nanoemulsifications, nanoemulsions of the vitamin E. That is the interesting US directions of study of this vitamin. Nanoemulsions are the kinetically stable dispersions that contain the two immiscible phase, aqueous and oil in the presence of surfactants. The preparations methods generally involve high energy processes such as high pressure, homogenizations, microfluidizations, and phase inversions, temperature emulsifications, for the productions of the stable nanoemulsifications. Preparations of the vitamin E using these methods produce more stable nanoparticulates and characterized by their low viscosity and long-term colloidal stability, again creaming and sedimentations compared to the conventional methods. Vitamin E nanoemulsion prepared using high-pressure homogenizations have been shown to produce smaller droplets, size between the 80 and 300 nanometers, resulting in a faster rate of lipid digestion. That is the scheme of the process of the synthesis of this emulsion. Apart from the oral delivery, vitamin E emulsion have also been tested for the transdermal delivery. For example, a method developed of the TRF nanoemulsion prototype to test the anti-cancer properties against human epidermoid carcinoma and human tongue squamous cells carcinoma in vitro. It was reported that TRF nanoemulsion showed the dose-dependent and more prolonged anti-cancer effect compared to the cells treated with the TRF and propylene glycol mixture control. Previous in vitro and the in vivo studies also confirmed that the TRF prepared as nano-microemulsions was safe for topical delivery, as there were no ocular and dermal irritations observed. Thank you for your attention, and I hope in the future you will open the new drug form, new variant of using of the pharmacotherapy for many our patients. Thank you for your attention.